Thank you very much, Ms. Georgieva. We will go to Bloomberg now to Naomi. Naomi, can you hear us?
Hi, yes, I can. Thanks for taking my question. I actually have one for each organization. First, WHO, we saw some countries in Asia tightening restrictions on public life today after virus infections popped up again. And I just wonder if you can help us understand how this sort of rolling, raising and lowering of restrictions might work throughout the world, and if this would be the new normal for the next year, or maybe the next 18 months, what should we anticipate? And second, an IMF question, do we have any assurances that China supports a postponement on official bilateral debt repayment?
On the issue of measures, I think many countries around the world have been climbing a very tragic and dangerous mountain of disease. And we need to be also extremely careful on the descent. We need to be watchful, be aware. We want this disease to go away. We want the numbers to drop. But as they drop, and as we try to come up with transition strategies to allow economies and social life to re-emerge, and nobody wants that more than us here at WHO, and all our medical and nursing colleagues around the world, our healthcare professionals. But what we need to absolutely ensure that if we want to transition back to a steady state with the virus, if we want to reach a point of disease control, we need to put in place the public health architecture. We need a massive investment in our capacity to do surveillance, contact tracing, isolation and quarantine. We need very good information systems. We need a highly educated, engaged and empowered communities around the world who understand what to do if they're sick, where to go, have access to a doctor, to a nurse, to testing, to isolation, to quarantine. And at the same time, we strengthen our healthcare system to deal with those who are very sick. And all the while developing new therapies and vaccines to solve this problem once and for all. If we want to reach that situation where we can live with this virus and have our economies back on track, we must make those other investments. As we do that, there will always be the chance, as we lift and as governments lift shutdowns, lockdowns, as people go back to school, we have to have in place to protect almost a safety net, the other things in the system that can trigger and maybe and may happen. We may have to modulate that. We may have to decide which are the measures we can put back in place, if necessary, to create more physical distance. And we don't want to end up in a cycle of lockdown followed by release, followed by another lockdown, followed by release. That's not the way forward. And the way to avoid that is we need a transition strategy that gets us back into more control of the virus. We need to get ahead of the virus, and then if we are in control, we can protect our economies. But if we lurch from lockdown to poor control, and back to lockdown, and back to poor control, that is not what anybody needs right now. So the investment we need to make, the lockdowns have given some time. They've taken the pressure out of the epidemic. We see that. This is precious time, not only to strengthen the healthcare system, as the DG has said, but precious time to put in place the public health architecture, the testing, the community education, and build this response from the community up. That's the challenge. And if we do that, we have a chance of transitioning back into a life, an economic and social life, that may, in some senses, not be the same again. Maybe a more caring, engaged society with a better healthcare system, with better universal access to healthcare, with more social justice and more care for each other. And that won't be a bad society to go back to. So from my perspective, we need to work hard now to put in place the comprehensive architecture of public health and healthcare if we're going to unlock safely from the economic measures or from the societal measures and population measures that are affecting and impacting people's social and economic future.
Thank Thank you very much. Would you, Ms. Georgieva, would like to answer the question, please?
Yep. Yes, thank you. Thank you for your question. China is constructively engaged on this issue of debt standstill for poor countries so they can weather the tremendous difficulties they're faced with during this crisis. We had a G20 Ministers of Finance call earlier this week. This topic of potentially having a debt relief for either countries, for poor countries, was on the agenda, and China addressed that issue by framing a set of principles they would be interested to see being integrated in that process. And it is also important to point out to China's decision to contribute to the catastrophe containment and relief trust that the IMF has been mobilizing to make sure that poor countries do not have to serve their debt obligations to the IMF, that this would be taken over by grant provision. And China is one of the countries that are making commitments to that fund, to that trust, the Catastrophe Containment Relief Trust. We will be obviously working with everybody in the next days, the G20, the Paris Club, IMF, World Bank. By the time of our spring meetings, we look forward to advancing this discussion.